In this video, we are going to learn about effect of lesions or the effect of transaction on respiration at the different levels in the brainstem. So in this diagram, you can see this upper one is a pons and this is medulla. And this upper one, these are pneumotaxic center, this is apneustic center, and these are the respiratory centers, DRG and VRG, that is dorsal respiratory group of neuron and ventral respiratory group of neuron. And in this, we will see the effect of the lesions at different levels with vagi intact and with vagi cut. What are the effects with vagi intact and with vagi cut? So one by one, we'll learn the effect of different transactions on the respiration. So the first one here is if the transaction is below medulla, then the signals which are generated in the respiratory centers, they cannot pass from medulla into the spinal cord, and whether the vagi are cut or vagi are intact, the respiration will ceases completely and there is a death of the patient. Then the second lesion is above the level of pons. With above the level of pons, if the vagi are intact, then all the respiratory centers they are intact, and if the vagi are also intact, the respiration is normal. Then, if the lesion is above the level of pons but the vagi are cut, then vagi acts as one of the inspiratory switch on the apneustic center along with pneumotaxic center. Even though the pneumotaxic centers are intact, the vagi are cut, so one of the inspiratory switch is lost. So the respiration, it becomes slow and deep because the inspiration is deep. So the respiration will become slow and deep in case of lesion above the level of the pons with vagi cut. Then the next lesion is mid-pontine lesion. If the lesion is between midpoint of the pons, then the pneumotaxic center they are cut. All the other centers they are intact. Then with pneumotaxic center cut and the vagi intact, one of the inspiratory switch is lost but vagi are intact. Then again the inspiration is deep and the respiration it becomes slow and deep. Then if the lesion is mid-pontine, the pneumotaxic centers are cut and also the vagi are also cut. In that case, both the check points on the apneustic center they are lost. That is, the pneumotaxic centers are also cut as well as vagi are also cut. So inspiration it becomes prolonged and there occurs inspiratory spasm and the breathing stops. That is called as apneosis. So if the lesion is mid-pontine and the pneumotaxic centers are lost as well as the vagi are also cut, there occurs complete stoppage of breathing. That is called as apneosis. Then the next lesion is lesion between the medulla and the pons. Here, these centers, the pneumotaxic apneustic centers which creates fine tuning of respiration, they are lost. So if there is a lesion between medulla and the pons with vagi intact or vagi cut, in both the cases the respiration it becomes irregular because the fine tuning centers which are present in the pons they are lost, even though there is a generation of respiration but it is irregular. So this is all about the effect of the lesions on respiration at the different levels in the brainstem. Thank you.